Hi, welcome back to Derm Talk. I'm your host, Dr. Shinjita, and I have the pleasure of inviting back Dr. Stephen Chen to talk to us today about skin cancer and sun safety. Those of you who have been able to spend a little bit of time outdoors know that the weather's gotten really nice now. There's a lot more sun and a lot more time to spend outdoors. May is actually Skin Cancer Awareness Month, and so we'll start out by talking a little bit about UV radiation. So could you tell us, Dr. Chen, a little bit about sun and sort of how it affects the skin?
Sure. So first of all, thank you for having me back, Dr. Das. And thinking about the sun, I think it's obviously it's what we love to enjoy in the summer. It's great to be out in the sun, and at least it feels great to be out, and you feel like you're healthy when you're out and just able to enjoy life. The problem, though, is that as dermatologists, it's also kind of our worst enemy sometimes, especially when we see patients that have to come in and have to deal with what happens when they're in the sun too much. So the sun, and obviously the sun, and even if it's a cloudy day, we have to deal with the fact that you could have a lot of exposure to UV radiation. And there's a lot of different types of UV, but for our purposes as dermatologists, the two types that we really care about the most are UVA and UVB rays. And I think the important thing to know is that they can both put you at risk for skin cancer, and they can also put you at risk for photoaging, so making your skin look wrinklier, making your skin look older than it has to be.
And Dr. Chen was talking about UVA and UVB radiation. So these are the two most common types of radiation that we get exposed to from sunlight. You can think of UVA, A for aging, and that's actually the rays that can cause skin to get wrinkled, develop the brown sunspots, and give patients and others the appearance of looking older than they really are. Now, the UVB rays are for B for burning. Those are the radiation waves that can cause sunburns. So let's play a little bit of fact or fiction. I love to incorporate this into each episode. So fact or fiction, getting a base tan is a healthy way to protect patients' skin from sun damage.
So I'm sure everyone can guess what a dermatologist would say, but for us that would be fiction, so that would be false. There's really no such thing as a healthy tan. It's really, any type of tan really shows that you've gotten some type of sun exposure, some type of UV exposure, which puts you at higher risk for aging, burning, and skin cancer.
And normally the pigmentation that you see with a tan is caused by the melanin pigment. And so anytime that there's sun exposure, melanin is actually designed to protect the skin from damage. And so if you develop a tan, that shows that your body's producing more melanin, and as a consequence is an indicator of more long-term sun damage. All right, so people get exposed to sun, increases the risk of skin cancer, but how common is skin cancer?
Well, skin cancer is very common. I think it's, you know, whenever we think about cancer, it's a scary word to say. In fact, in the hospital, very often we call it the C word because we don't want to talk about it directly, just because it's something that's such a scary idea, scary concept. The good news is that most skin cancer that we see is very treatable, very curable, as long as you see a dermatologist when you start to notice something that's suspicious, and I'm sure we're going to talk about what that might be. Basal cell carcinomas and squamous cell carcinomas, or what we call the non-melanoma skin cancers because they're not melanoma, those are the most common skin cancers and also really the most common cancers in general that anyone can get, especially here in the United States, just because of the genetic makeup of our population and what the sun does with our types of skin. We have to be careful about those types of skin cancers. But again, they're very treatable, and so it's always good to see a dermatologist.
Absolutely. And just to give you guys a sense of how common skin cancers are, 1 in 5 Americans will develop a skin cancer over the course of their lifetime. And that includes the basal cell and squamous cell carcinomas that Dr. Chen was talking about, as well as melanoma, just to give you a sense of how common it really is. So another fact or fiction question for you. So only fair-skinned people should be concerned about skin cancer. Fact or fiction?
So again, fiction. Again, it's false just because anyone can get skin cancer. It is much more common to see basal cell and squamous cell carcinomas in fair-skinned individuals. And a lot of that, again, has to do with the genetic makeup and how the sun affects that skin type. But that said, folks of a darker complexion also have the risk of skin cancer, and it's not just, they of course run the risk of the same type of non-melanoma skin cancers of basal cells and squamous cell carcinomas. And those types of skin cancers, to really prove the point, often show up in areas that aren't sun exposed. And so we know that while the sun is a big factor, sometimes genetics or the underlying skin is really the reason why you get those skin cancers. For the darker skinned individuals, I think it's also important to think about the other types of skin cancers. So the biggest one that we always talk about is melanoma. And melanoma is more of a, although also affected by the sun, has a very strong genetic component as well. So we definitely have to be careful in anyone about skin cancer.
And just to give you guys a little bit more of a sense that people of skin of color should be concerned about skin cancers, so up to 30 or 40% of melanomas occur at the bottom of the feet in darker skinned individuals. And that's an area that's usually not exposed to the sun. And a story that I like to share with people is that the reggae singer Bob Marley actually passed away from melanoma. And so that's something that we want to raise awareness, not only among people of fair skin, but also darker skin, to know that you need to stay aware and keep an eye on your skin as well. All right, so you've alluded to the different types of skin cancers, but let's just put it out there for the audience what the 3 most common types of skin cancers are.
Sure. So I've already mentioned them, but I'm sure it's the 2 most common types that we see in fair-skinned individuals are the basal cell carcinoma and the squamous cell carcinoma. And then the third one that we see really obviously very common in fair-skinned individuals as well, but also we think a little bit more about with those folks with skin of color would be the melanoma.
All right, so let's start out with the basal cell carcinoma. You've been telling us a little bit about it. That's the most common skin cancer in the world. And so what parts of the body typically develop the basal cell skin cancers?
So I'm sure if any of you have been to a dermatologist before, then you'll notice that we focus a lot on the face, we focus a lot on the arms, especially the backs of the hands, just because anywhere that's been exposed to sun a lot, those are the areas where we worry about these types of skin cancers. So really, we see basal cell carcinoma a lot in those areas. For example, the nose is a very common place that we see basal cell carcinoma, the ears, anywhere on the upper chest if that's areas exposed, or the upper back, and again on the arms. The other thing to remember is that for those individuals who might not be blessed with a full head of hair, the scalp is also a place that we have to be very careful about these types of skin cancers.
Great, and if you just take a look, this is a few pictures of basal cell carcinomas. The most common type of basal cell carcinoma actually will show up as a pearly white bump in the sun-exposed areas, as Dr. Chen's been mentioning. Some signs to keep an eye out for is if you have a sore that isn't healing in an appropriate amount of time. So if you have a sore that's been there for months and it's starting to bleed, heals a little bit, starts to bleed again, that might be a spot to bring to attention of a dermatologist or your primary care doctor. And so another thing to keep in mind is that a lot of times people will ask, oh, well, you know, I've had this basal cell carcinoma, it's been treated. What's my risk for developing other skin cancers, whether they're basal cell carcinomas or melanomas?
So once someone has a basal cell carcinoma, or any type of skin cancer really, your risk of another skin cancer goes up quite a bit. And part of that is because we know that for you, that means that you may have gotten more sun exposure than, let's say, someone else who's walking down the street. And so for that reason, once you've had one of these skin cancers, we know that you're at higher risk for that reason, and also potentially your genetic makeup may put you at higher risk as well. So really, once you've had one basal cell or squamous cell or melanoma, you're really going to be seeing the dermatologist quite often so that we can keep a close eye on everything. And when we talk about sun exposure, we're not talking about necessarily sun exposure, say, last weekend giving you a basal cell today. It's more like sun exposure that you had when you were a kid. And so if you had a lot of blistering sunburns or you spent a lot of time in the sun, back when people really didn't use sunscreen all that often, and people would sit out in the sun with their reflectors and their mirrors and try to get a quote-unquote healthy tan that we know isn't safe anymore. Those are the folks that unfortunately now we have to deal with a lot of these skin cancers.
All right, so moving on to the second most common skin cancer, the squamous cell carcinomas. So take a look at some of these pictures of squamous cell carcinomas. These will occur also in sun-exposed areas. Some of the more high-risk areas include the lips and the ears. These will generally be some crusted, scaly patches. Sometimes they can be rapidly growing and show up as bumps as well. And so with the basal cell carcinomas as well as the squamous cell carcinomas, Dr. Chen, what are some of the concerning features in terms of why is it important to have these detected and treated? What happens if they go untreated?
That's a great question. So they're a little bit different in that basal cell carcinomas very rarely metastasize, or they very rarely go to a different area of the body. It happens, it still does happen, but it just happens less commonly than squamous cell carcinomas. Squamous cell carcinomas can go to other areas of the body. So for example, if you had a squamous cell on the side of the face on the left-hand side, very often, I shouldn't say very often, if you get it treated, it doesn't happen. It doesn't happen, we can't say 0% of the time. But if it doesn't get treated, then you have a much higher risk that it does metastasize, and that means it could go to the lymph nodes, or it could go to the lungs, it could go to a different area. That's why it's important to have all of these taken care of. I think the other thing to think about is that if you don't get it treated and you just leave it there, it just keeps on eroding and keeps on spreading, and so you end up with a pretty large sore or ulcer on the side of the cheek or on the scalp. So it definitely is a good idea to get these taken care of. Obviously, the earlier you get to the dermatologist, the easier it is to get rid of them.
Absolutely. And so, like Dr. Chen was saying, the biggest thing is to have these lesions, anything you're not sure about, have it checked out by your doctor. And oftentimes there is a risk. If you leave it unattended, you say, oh, you know what, it's there, it's not bothering me. The problem is that it can be growing deeper underneath the skin surface, which you might not be able to see with the naked eye. And so it's really important to have these treated. All right, so moving on to melanomas. Unfortunately, melanoma is the deadliest of the 3 most common skin cancers. In fact, 1 American dies every hour from melanoma. Tell us a little bit more about the risk factors for melanoma and some features that we need to look out for.
Sure, and so it'll sound like we're kind of beating a dead horse here because we keep saying the same thing, but really it's important to try to limit the amount of sun you have, because sun exposure is one of the biggest, or I should say UV exposure is one of the biggest risk factors for melanoma. The other thing is that if you have a very strong family history for melanoma, if a lot of your family members have gotten melanoma before, then it also could mean that you have a mutation, genetic mutation that could put you at higher risk for developing a melanoma as well. So the things that we look for in a melanoma, that I think there's a really neat mnemonic that we always use and we always teach our patients, and that's ABCDE. So it's an easy way to remember what to look out for something that's suspicious that should be brought to a dermatologist's attention, or at least a doctor's attention. The A stands for asymmetry. So what that means is if you have your mole, so melanoma is basically a mole that's gone bad. You could think about it that way. But so if you have your mole, if you can't draw a line down the middle and fold it in half and have it look exactly the same on both sides, then that means that it's asymmetric and it's a little bit more concerning. B stands for borders, so if the sides of the melanoma, it's not a perfectly round dot, if it is kind of jagged on the edge, that's where we get a little bit more worried too. The C is for color, so usually our moles are a nice, flat, even brown color, and if you start to see reds and blues and different shades of brown, then that starts to worry us. A D is for diameter, so Those old-fashioned pencils that very few people use now, but the eraser tip is 6 millimeters in size. So that's an easy way to remember it. Anything bigger than that is sometimes concerning. Excuse me. The E is for evolution. And I think that's the most important thing, is that if you notice that this mole is changing, if it's bleeding, if it's itching, if it's starting to give you some trouble, so any change in the last few days to months to years should certainly be brought to the attention of a dermatologist or your primary care doctor, to someone who can help you take a look at this spot. Some people actually like to have an F as well, but that's just for some people. F for funny looking. So if there's any type of mole that just freaks you out, it's funny looking, and you just want to get it checked, it's always a good idea to have a doctor take a look at it.
Absolutely, thank you. And so remember the A, B, C, D, E's of melanoma. And you'll be able to see this popped up on the screen, so you can take a look at that. And I think one misconception that people often have is that skin cancers are just for quote-unquote old people. And a message that I really want to pass on to some of our younger viewers is that melanoma is actually the most common cancer in general in people of ages 25 through 29. And so there's a really big push to raise awareness among younger people to say that younger people are not necessarily immune to melanoma, and hopefully we can keep people out of the sun, keep people out of the tanning salons. So who gets melanoma typically?
So unfortunately, the answer is really everyone can get melanoma. So it's not an easy. No one's really safe from this cancer. But the people that we think about are the people who've had a lot of sun exposure in the past, and the people who have family members who've had melanoma. And then the other thing is, just like we said before, if you've had one melanoma, it certainly puts you at higher risk for another one. So you'll be seeing a dermatologist very often.
Absolutely. And especially we keep an eye out for patients who have fair skin. If you tend to burn in the sun very easily, that's a risk factor. Having blonde hair, red hair, blue eyes, green eyes, those are all things. If you tend to make a lot of moles in general, that's a risk factor, because one or more of those moles could become funny looking at any point. And again, keep in mind, darker skinned individuals are not immune to developing melanoma. And so that's really what we want to raise awareness, is that everyone is susceptible to developing that. All right, so I just want to pop up some pictures for you guys of melanoma. And just keep in mind the A, B, C, D, E's of melanoma. So another fact or fiction question for you. So skin cancer can be easily treated if it's detected early.
So that's definitely a fact. Anytime you have something on your skin, or anytime you have any type of a medical problem, really, if you see a doctor sooner rather than later, it should really be a lot easier to treat. If you see the doctor for skin cancer early enough, often it's just a little surgery that can take care of that skin cancer. Some skin cancers can be treated with creams, or can just be treated with what we call cryosurgery, where we just basically freeze the heck out of the skin cancer. And then sometimes we do certain procedures where we just scrape and burn the skin cancer. But the second they get too big to treat, then that's where we start talking about having to do a bigger procedure, and sometimes having to go to the operating room. So it's always good when they're small and you're worried about it to bring it to a doctor's attention.
Great. And so we've been talking a lot about what skin cancers look like, what to look out for. So how do you recommend that people do skin exams at home? How do we check out the skin at home?
That's a great point. So we obviously, as dermatologists, we see people every so often, every 6 months, every year, that type of thing. However, in between, we're really counting on our patients to do their part and to really help us with trying to detect any changes. So the way to do that at home, I think the easiest thing is that if you are living with a spouse at home, living with your partner at home, having your spouse or partner actually really take a look at your skin every so often, and we like to say every month.